All right, so get this. We're going deep on exercise and chronic conditions today.
Oh, nice.
Yeah, looks like a lot of you are curious about it too.
Sure, it's a hot topic.
We've got, let me see, some info from the Mayo Clinic
Huh?
and even dug up some personal stories from YouTube.
Hmm, interesting.
Some are, well, they're pretty inspiring actually.
Yeah, I was looking at those too. What really struck me is we're not just talking about managing symptoms, right? I mean,
Right.
exercise could actually, really improve your quality of life,
Mm-hmm.
even prevent things from, getting worse.
That's what I thought too.
Yeah.
And honestly, I always thought if you're sick, exercise is off the table.
Oh, I hear that a lot.
Is that just a myth then?
It is. It is a myth, and the Mayo Clinic is very clear about this.
Okay.
Exercise is not just okay, it's often essential.
For people with chronic conditions.
Exactly.
Huh. So it's not if you exercise, but how you do it.
Exactly. And that's where you got to work with your doctor or healthcare provider, whoever
Yeah,
it
yeah.
is. They can help you tailor a plan that's safe, effective, all that.
That makes sense.
Yeah.
So let's get specific. Like, what are we actually talking about here?
Okay.
Just a walk around the block, or are we hitting the gym?
Well, there are a few categories to consider, I guess. Aerobic exercise, that's first, like
Yeah.
brisk walking, cycling,
Yeah.
swimming, anything that gets the heart rate up.
Okay. Classic cardio.
That's good for the heart, obviously.
Yeah.
And stamina, weight management.
Right. But not everyone can handle high impact stuff, right?
No, you're right.
Without them.
You got to tailor it. That's where the other types come in.
Okay.
Strength training, that's building muscle,
Okay.
lifting weights, resistance bands.
So even if you can't like run a marathon or anything,
Right.
you can still get stronger for everyday life.
Exactly. And bone density, too. That's
Oh,
important.
no. Especially as we age.
And then there's flexibility, keeping that range of motion.
Yeah, yeah.
Stretching, yoga, all that.
I like a good stretch.
Me too.
What about balance, though?
Oh, absolutely.
That exercise?
Definitely. Think Tai Chi, even just standing on one leg.
Sure.
Important for, older adults, anyone who might be at risk for falls.
Okay, so we've got our exercise toolbox. Got it.
Right.
Cardio, strength, flexibility, balance.
Mm-hmm.
How does this actually apply to, you know, different conditions, though?
Right.
Say someone has arthritis. Does working out help?
It does. The Mayo Clinic highlights arthritis as a, prime example.
Really?
Yeah, it can reduce pain, strengthen those muscles around the joints,
Yeah.
improve mobility.
Interesting. It seems kind of counterintuitive, but
Yeah.
it sounds like movement really is medicine.
It can be.
Now, what about diabetes? How does exercise fit in there?
Oh, it's crucial.
Yeah.
The Mayo Clinic says it can be as effective as some medications in regulating blood sugar for type 2.
Wow.
It helps with weight control, boosts energy, all that.
So it's not just about feeling good.
Right.
They're real physiological changes.
Exactly.
What about heart disease? Is exercise safe for people with that?
Not just safe, it's often prescribed as a key part of treatment.
Really?
Yeah, strengthens the heart, blood flow. It
Or-
can reduce the risk of, more problems.
So it's like a workout for your heart, making it stronger.
Exactly.
This is fascinating stuff. I'm really intrigued by all this.
Yeah.
Let's dig into some more conditions before we move on.
Sure, sounds good. What else are you curious about? It's crazy. We always focus on how exercise makes us feel, the stuff we can see.
Yeah.
But there's so much happening beneath the surface.
Like what?
It's impacting us, at the cellular level.
Okay, now you've got me really curious. I like the sound of hidden benefits.
All right. Well, our bodies evolved to move.
Makes sense.
Our ancestors, they were always active.
Yeah, we're not exactly chasing down dinner anymore.
No, not really. And all that sitting, it sends the wrong signals to our cells.
Oh, interesting.
Exercise helps, reset things.
So what's actually getting, switched on,
We'll take mitochondria, the powerhouses of our cells.
right? They produce energy.
Exercise makes them more efficient.
Wait, so the more I move,
Yeah.
the more energy my cells can actually make?
It's true. And it's not just energy.
Okay, what else?
It boosts our defenses against free radicals.
I've heard of those, but I don't really get what they do.
Think of them like little rust spots.
Rust spots.
Yeah, forming in your body. Exercise helps produce antioxidants, which are like rust removers.
So they neutralize those free radicals?
Exactly.
So exercise is like a tune-up for my cells.
Yeah,
Keeping them running smooth and protecting them from damage.
exactly. And there's even more.
What?
It impacts our hormones too. Increases production of IGF-1 that's crucial for cell growth repair.
Oh, wow. Cellular rejuvenation.
Right, it's like a fountain of youth.
What else is going on in there?
Well, remember the immune system.
Yeah.
Exercise supercharges that too, increases circulation of immune cells.
Like sending out more troops.
Exactly. And here's a big one. Exercise helps regulate inflammation. Some inflammation is normal, but chronic inflammation, that's linked to a ton of diseases.
Right. Heart disease, cancer, all that.
Exactly. So exercise keeps that in check.
So important for long-term health.
And we can't forget the brain. Remember, blood flow.
Yeah, you mentioned that before.
Exercise increases blood flow to the brain, more oxygen, nutrients, all that good stuff.
That's why I always feel more alert after a workout.
Right.
But are there long-term brain benefits too?
Oh, absolutely. Supports cognitive function, memory, overall brain health, even stimulates growth of new brain cells.
New brain cells, seriously.
Seriously, it's like giving your brain the resources it needs to thrive, stay sharp.
That's incredible, but with all these benefits, is there ever a downside, especially for someone with a chronic condition?
Well, that's a good question. Exercise is generally good,
Right.
but there are situations where you got to be careful.
I see, so it's not one size fits all.
Exactly. Someone with a heart condition needs a different plan than someone with, say, arthritis.
Yeah, that makes sense.
Their doctor needs to assess their situation, recommend what's appropriate, activities, intensity, all that.
What about folks with arthritis?
Yeah,
I imagine high impact could be bad for their joints.
you're right. They might need to modify things.
Okay.
A physical therapist can help design a program, make sure it's safe and effective.
So working with healthcare professionals is key,
Absolutely.
especially when you have a chronic illness. Makes sense.
But what about motivation?
Ooh,
Starting and sticking with exercise, that's tough for a lot of people.
it is. Any tips?
Well, one thing that helps, focus on the immediate benefits.
Oh, okay.
How do you feel during the workout after notice the mood boost, the energy, that sense of accomplishment, those feelings can be motivating.
So it's about like enjoying the moment.
Yeah, and find an activity you like.
Oh, right.
If you hate running, don't run.
Makes sense.
Find something you love. Dancing, swimming, hiking, even gardening.
Make it fun, not a chore.
Exactly. And what about a workout buddy?
Oh, good idea.
Social support is huge. Accountability, encouragement, makes it more fun. You can even join a class, for that community feel.
Right, right. What about setting realistic goals?
Oh, that's crucial.
Sometimes I think I aim too high,
Yeah.
then I get discouraged.
You got to start small, gradually increase your activity.
Okay.
Remember, consistency is more important than intensity.
Small steps, big results. Right.
Exactly. And celebrate your successes along the way.
Every step is a win.
Exactly.
This is great advice.
It's about making exercise a positive part of your life, not another chore.
I like that. Not another thing on my to-do list.
And remember, it's never too late to start. No matter your age, condition, there's always something you can do.
That's really inspiring.
It is.
Before we wrap up this part, let's get back to those YouTube videos.
Oh, yeah.
The ones with like demos and tips for people with chronic conditions.
Yeah, those are great, especially when you're starting out, like exercise videos for people with chronic conditions or aerobic exercise 45 minutes for adults living with chronic conditions.
I saw
They
them.
walk you through things, show you how to do it safely.
Right, and there are even videos for specific conditions.
Oh, yeah, for sure.
Like exercising with chronic fatigue syndrome, do's and don'ts.
It's so helpful for navigating those individual challenges.
Absolutely. Real-world insights, experts, people living with these conditions. It's encouraging.
It is, for sure.
Okay, so we've covered a lot.
We have.
Science, benefits, safety, motivation. I'm feeling pretty pumped up.
Me too, but we're not done yet.
Oh, there's more.
In the final part, we'll look at the mental health impact, the exciting idea of exercise as medicine.
All right, listeners, don't miss it. Stay tuned for the final part of our deep dive. All right, welcome back for the last part of our deep dive.
Yeah, I'm glad to be here.
We've talked about all the physical stuff,
Right, the benefits.
especially for people with chronic conditions, but now I'm really interested in the mental side of things.
The mental and emotional, yeah.
Because I definitely feel better after exercise.
Yeah.
Like, my mood is better, less stressed, but is there actual science behind that?
Oh, yeah, definitely. When you exercise, your brain releases endorphins.
Okay.
Those have mood-boosting effects, pain relieving.
So it's like your body's natural happy drug.
It is. It's like a natural cocktail.
Wow. So it's not just a placebo effect.
It's real chemical changes.
In my brain.
Yeah, and it's powerful.
So working out can actually help with conditions like depression or anxiety.
It can. It's recognized as a treatment now.
Really?
For mild to moderate cases, studies show it can be as effective as medication sometimes.
That's amazing. So it's not just temporary relief.
Right, it's managing those conditions.
Wow. I'm seeing exercise in a whole new light.
Yeah.
What about stress, though?
Oh, exercise helps there too.
Really? Because I feel like I'm always stressed.
It helps regulate your body's stress response system.
Okay.
Lowers cortisol, that's the stress hormone, which can be really bad if it's high for too long.
So it's not just feeling less stressed, it's actually changing how my body handles it.
Exactly. And remember how we talked about blood flow to the brain?
Yeah, increasing it.
That has a positive impact on thinking too.
Right, new brain cells, all that.
It can improve memory, focus, all those cognitive functions.
So it's like a workout for my brain.
Yeah, keeps it sharp, protects against cognitive decline as we age.
That's incredible. It's not just the specific benefits, but I feel more connected to my body when I exercise,
That's interesting.
like more aware of how it feels, my
You're
strengths.
tapping into embodied cognition there.
Embodied what?
It's the idea that our physical experiences affect our thoughts, emotions.
So it's not just muscles, it's like a relationship with my body.
Exactly. When we move, we get more in tune with ourselves.
We learn to listen to our bodies.
Yeah, appreciate what we can do, respect our limits.
I love that it's like exercise is self-discovery, self-acceptance.
We can be.
So with all this, can we call exercise medicine?
More and more healthcare professionals are saying yes.
Seriously.
There's a real movement to see it as a legitimate treatment.
Especially for chronic diseases, right?
Exactly. Some doctors are even prescribing it, like they would a drug.
Wow, that's a huge change. What kind of conditions are we talking?
All sorts, heart disease, diabetes, arthritis,
Yeah.
depression, anxiety, even some cancers.
So it's about real results, clinical outcomes.
Exactly. And the research is there, showing it can be as effective as medication, sometimes even more.
This is revolutionary. It feels like we're just starting to understand how powerful exercise can be.
We are. It's an exciting time to be learning about all this.
It really is. This deep dive has been eye-opening. We've gone from cells to mental health to exercise as medicine.
Yeah, we've covered a lot of ground.
I hope this has inspired you all to move your bodies, experience it for yourselves.
Me too.
You don't have to be a marathon runner. Every little bit helps.
Exactly. Start small, find what you enjoy, listen to your body.
And if you have a chronic condition.
Talk to your doctor. Figure out how to exercise safely.
Great advice. So to wrap up, one last question for everyone listening. If exercise was a medicine, would you take your daily dose?
I think we know the answer.
Get out there, move, embrace the power of movement.
Absolutely.
Thanks for joining us on the deep dive. See you next time for another exciting exploration.